when you start to see people that have dementia and you see them gradually lose themselves and their families lose them as well, it's a really heartbreaking thing to see. So part of my motivation to going into treatment trials was to try and change that. But of course the other thing is it's so common that we all know someone who's got Alzheimer's. So the work I do focuses primarily on early phase trials. So this is where we have really groundbreaking therapies or therapy candidates. We use them to try and treat people for the first time. And those therapies target different proteins in these diseases like Alzheimer's disease. BIB080 is a really exciting drug. We started studying this in 2017. This is a gene silencing treatment. So what it does is, instead of the existing treatments that we're just starting to see come through, they mop up proteins that have been produced already in the brain. These gene silencing treatments work upstream of that. So what they try and do is prevent production of those proteins in the first place by modifying the production of proteins from the gene. And the first treatment trial that was done in that in Alzheimer's, we started in UCL. We put the first patient in the world in UCL in 2017, and we just published the results of that first phase 1 trial, which showed that we can, using this gene silencing, reduce production of tau, which is one of the proteins in Alzheimer's disease. So that's really exciting. So the next stage is to give it to hundreds of people, and to show not only that it's safe in that group of people, but also that it can change your clinical function. So it gives you benefit in addition to reducing the proteins. So that's the next stage, and we've just started that. So the fact that we have treatments coming down the pipeline now that are going to change dementia means we really have to have a revolution in the way that we treat people with dementia. At the moment, our services aren't fit for purpose. If those treatments turned up right now, we would not be able to give them to the people that need them in the right way and safely. And so it's a tragedy that we haven't had these treatments for so many years, but the real tragedy is that we have them and we can't give them properly. So we have to change our services, and right now NHS England and other bodies need to focus on how to do that. What I'm really passionate about is that we develop a network across the country where we build bridges, where we don't keep in our castles, and that way we'll improve both our services and our research for all of our patients wherever they live.